Oh no.
And day before yesterday.
Okay, you still got the new puppy smell. Okay, get rid of the new smell.
It's okay, Rufus.
If I enlarge it, worm is here.
Okay.
And there's some white specks there, wriggling
Okay.
also.
Okay.
So what kind of worm is that? Flatworms?
The most common one they get will be roundworm, followed by hookworm. Hookworm is more concerning because it can cause severe bleeding.
Okay. So far he hasn't bled yet.
Okay. Bleeding as in bleeding in the stool.
No.
And this usually it looks dark brown in color, not fresh blood. It starts with fresh blood in the stool, then followed by very dark brown color to black. It's not always something you can see if it's
I
mild.
see.
Tapeworm looks smaller. I don't think that's tapeworm. It's either roundworm or hookworm.
I see.
Okay. He's got a good appetite?
Yes.
Okay.
He's
good.
very frisky, he's normal, he's hyper.
That's good. What are you feeding him currently?
Akana, lamb flavored
Okay.
kibble.
Okay.
And then just yesterday we started with some chopped carrots and chopped apples.
Okay, so
which
that
he has been eating quite well.
that has to be in a lot of moderation.
Yeah.
Okay, both carrots and apples,
Okay.
because for some reason some dogs can't digest carrots. It comes out in chunks.
Yes, it does. It did.
Okay, so
Sorry, Dr.
Yeah.
Lee. For Fumasil, is 1 tab to 30 ml.
I think 100 ml.
I'm basing off the only deduction.
I think it's as you say, it's more diluted.
It's so quick.
600 mg, so I need
Oh,
30 ml lah.
30 ml. That
So
one
yeah,
is from deduction.
just now I said 100, so my mistake.
oh.
Okay, so the carrots may not be always suitable.
Okay, so apples are okay.
Apples also gotta be careful. Why I say moderation is it can cause a lot of gas. So we have some dogs that got really bloated and uncomfortable after
I
apples.
see,
So
I
in
see.
moderation.
Okay.
I
In
think
moderation meaning like what? A
Moderation.
quarter piece of the
He's-
apple.
he's really tiny right now.
Mm-hmm.
So probably a quarter a day for
Okay.
now. When he's older, he can get more.
Okay.
And chopped up, yes,
Yes.
better. And think of all these as a treat.
Oh,
So not main meal.
okay.
Because carrots and apples are not enough nutrients for you as a main meal, but as a treat, it's a very safe treat.
And I have also been giving him probiotic
Okay.
as well as, and I stopped after a while because he started having diarrhea. Then I stopped it.
Probiotics should
Shouldn't be,
helping with diarrhea, not the other way.
Yeah, but
Do you
I don't know why he got diarrhea after he had took
Okay.
probiotic.
Do you remember the brand? that you use?
I think it's that Dr. Shibu.
There's a
brand.
Dr. Mercola.
There's a Dr.
There's
Shibu.
the other
Happy
one's-
Paws or something.
Okay.
Yeah.
All right. Okay, I need to check your teeth. Can I check your teeth?
Say Rufus.
Oh, baby teeth. Okay, no adult teeth yet.
Mhm.
All right. Eyes.
Check it.
And then now gotta check your
Open your eyes, boy.
Check your eyes. Okay, that's okay. Can you see? Can see, right? Yeah, I can see that. Ears are clean.
And he's been biting his butt the last 2 days very frequently, but today he stopped.
Can be from the diarrhea. Okay, itchy.
Itchy.
Mm.
But we always wipe his butt with
Okay.
the wet tissue.
He's got a very slight hernia here. I'm not sure you noticed. He's got a lump here. This is an umbilical hernia.
Okay.
If let's say, for example, in the future you decide, you're not relax.
He doesn't like
Rufus,
it.
relax.
You decide to sterilize him, we can get the hernia.
I am
fixed
going
at
to
the same time.
sterilize him.
Yeah.
Probably here also.
Okay, we'll get the hernia fixed at the same time.
Okay.
Right now, this is small. It's reducible. Reducible means
Will it cause any problem in the future if I just leave it?
if
If I leave it
gets
untreated?
bigger, if it gets bigger, we don't know whether it will get bigger.
So the best thing is when he's getting sterilized
Yeah.
is to just remove.
Okay, relax. Okay.
This is what he does. I just don't know what to do when he
He
does
doesn't
that.
like to be restrained, but you gotta be fine with restraint. If not,
Yeah.
can't cut your nails, can't do anything to you. Okay, relax. Nothing's gonna happen. So your nails do need trimming. Okay, a bit too long. Attempt to cut. Okay. Because hernia currently right now, what is herniating out, pushing out is some fats under the skin. But if the hole gets too big, your intestines can come out as well. That will be a problem.
Okay.
Yeah. So you just gotta watch. Every day you feel. So you
Okay.
can push it back in.
Okay.
You can push
And
it
when
back in,
should
it's
I
fine.
get him sterilized? At what age?
No rush for him, okay, because he's a boy.
Mm.
We want him to grow well first. You do not have female cat dogs at home, so that's fine.
Mm.
Relax, okay, relax.
How long for the nail wash?
Daily until I told her actually already told her, daily until the pus is better, then you can go back on to just Zymox with hydrocortisone. Yeah.
All the way,
Yeah, she has that. Yeah.
But just use all the way is okay.
Yeah, it's okay. All right, I'm gonna check the rest of you. Okay, you're a good weight. Okay, despite having diarrhea.
I thought he's a bit too skinny.
No. You're just nice. You're just nice because we can still feel a little bit of spine, a little bit of rib cage.
Yeah.
You can't
And I
feel
thought
anything.
that means that he's underfed.
No, you gotta feel a little bit. You can't feel anything, then it's too chubby.
Then it's too big.
Yeah.
Okay.
Followed by, we gotta be able to see some
Rufus,
waistline here.
Mama
Okay.
boy.
Rufus,
See
relax.
the waist is rounder around,
Relax, boy.
narrow around here.
Okay.
Not much waist now because you're a puppy lah. But when you're older, you can see this part is supposed to be a little bit of an hourglass shape.
Okay.
Okay, all right. You just can I check the?
See, the doctor wants to check
I'm gonna
you.
check you. Okay, good boy. Okay, I'm just gonna hang on to you. Again. Okay, let me just pass him to me. I hope this way. Okay, relax.
Relax, baby.
Okay.
Relax, boy. Relax. Calm down.
Mama boy. Mama boy. Mama boy. Here. Here, mama.
Okay, your heart sounds good.
Relax.
Has he just cooked today? I mean, a few hours ago.
Yes, just a few hours ago, an hour or two ago.
Okay. About food, has he eaten? Just.
Kibble? Just his kibble.
Your abdomen sounds very gassy, huh?
Yes, that's what I kept feeling when I carry him at times. Some
Okay, I
gas
need
is
to
moving
pass it
inside.
to you
Okay.
so that I can take this off. It's very, very noisy inside. Very gassy there. Okay, let's see.
What's she doing? What's she doing? She's checking you.
you.
Oh, I can feel the gas. She's checking you. She's gonna make you
Not
feel
in pain,
better.
that's fine. So he had this when you got him?
Yeah, I mean, my friend told me that another big dog had attacked him and then she had it treated.
This is a scar, It's
Yeah.
not going to grow, the fur is not going to grow back anymore.
Oh no, really?
I don't think it will grow back.
Is there any way I can encourage the growth? Anything I can do, apply?
A little bit hard, maybe some time. We'll wait and see, because whenever we have like shiny skin like this, right, the layer with fur, the hair follicle is already gone. Same with here.
Poor
Okay.
baby.
Maybe if your fur grows longer, then it's not going to be so obvious. Okay.
What's she doing to you?
About
What's she
this
doing to you,
knee.
sweetheart?
So you're fine being dangled, but not carried. Okay. All right. Okay, that's it. So you gotta watch the hernia. Apart from that, you look okay. The worms, usually what we do, we start them on deworming tablets, kill off the parasites. When they have very high burden, actually we gotta be careful.
What's high burden?
A lot when you have a lot of worms. So if you have a lot of worms in the intestine, we give them the medication to kill them off. If they die off too fast, it actually can cause a lot of pain.
Okay.
It can be dangerous.
Okay.
So we need you to help us watch how we see after medication. Is he comfortable? We still
How
want
do
him
I?
to
What are the signs of when he's not comfortable?
quiet, hiding, not very keen to play, not very keen to eat, curling up most of the time. Okay, those are not good signs. We don't see this, it's not very common. But if you see those, we gotta know. If let's say he's fine, but with the deworming tablet, there's still deworming medication, there's still a lot of worms in his poop. We will need to repeat this again. So we do a course for a few days, we stop, then we start again a few weeks down the line.
Okay, so if you're giving me the deworming medicine, so I let him have it now? Here or at home?
It's not just one time. It's once a day for a few days.
Oh.
Depending on what product we use. Like I will decide based on his weight. Oh, I've got the weight yet.
They haven't weighed him yet.
Yeah, we gotta weigh you again. What else for you? For the food, how often are you feeding him?
3 times a day.
Okay, 3 times
8
a day.
a.m., 1 p.m., 7 p.m.
If you can space it up more, might be better.
Like
Okay.
what time?
Because, for example, if you feed once a day, it will be every 24 hours. Twice a day, every 12. 3 times a day, we want every 8, because from 8 to 1, that is only 5 hours. 1 to 7 is 6. But 7 p.m. to 8 a.m., that's 11 hours. Very far. So we have some dogs that get too hungry, they vomit bile from hunger.
Yes, he did that today morning.
Or they don't want to finish their
Because he had
breakfast.
diarrhea, right? A lot of
Yeah.
times. So today morning he vomited. Oh no, he didn't vomit, but he passed out. Like really nothing like that. Extremely just water only, brown
Okay,
water.
Okay.
Show him, you took water, right?
If not, he might not finish his lunch or dinner because he's still full from breakfast. So it's like split it apart a bit more. Maybe not lunch, but late afternoon meal and a late evening meal. There'll be more even.
So that means what, 8 o'clock in the morning?
8,
And then
4, then close to midnight. Well, we can do 10.
Okay, so 8, 4 and 10 p.m.
Let's see how is he. Okay. So I understand you're opting for the healthcare package, right?
Yes.
Okay, so that includes doing a little bit of blood test for you, so we
Yeah.
need a little bit of blood sample. Hopefully okay. We're checking for presence of tick disease, presence of female heartworm. If it's negative, you can start on the preventative immediately. It also includes checking basic things like liver values, glucose, kidney, protein values.
Yeah.
So
Okay.
a little bit of check.
So can I also check?
Yeah.
So now what you're going to do is the deworming and
We're going to collect blood,
uh-huh,
run the test,
uh-huh,
we'll dispense the dewormer for you.
okay. And then the dewormer, you will let me know what's the dosage like.
Yeah.
And then he already had his first round of jabs.
It's how to say, do you have the vaccine card with the sticker?
No, I don't have it.
Yeah, and the first round of jab will not mean much also, even if he did, because he's very young. Usually the vaccine can be done from 4 weeks old, but most of the time we start from 6 to 8 weeks. Okay?
Okay.
So this is not a protocol we set, this is a protocol that everybody follows. We can start the first vaccine around 6 weeks old, and it's usually repeated every 4 weeks until they are at least 16 weeks before we stop.
So now he is already 2 months plus.
He's only like 8 weeks plus. So even if you had one in the past, regardless, he's still going to need probably at least 2 to 3 boosters. Since he's not too well now, he has some diarrhea, we cannot restart yet. Do you have other dogs at home?
No.
Okay.
Only I've got 3 other birds.
Okay, but make sure he doesn't eat their poop because that's a very common cause of diarrhea as well. Okay.
He did a couple of this is very fast.
And it can be quite serious as well. We've seen bloody diarrhea with bird poop. Okay, so
Okay.
no eating random funny things.
Okay. How about bird seeds and all that?
Not ideal also because very high in fat content can also cause diarrhea and vomiting.
I see.
Yeah, okay.
So you have to be very careful.
So everything I take away. He's a puppy. He's gonna like to bite and chew a lot of random things. So no putting things on the table, on the floor.
No.
No string, no rubber band, no ear pods. They will chew on those. No cable ties, hair bands. All these they will try and chew and eat. So everything I move it away.
You never did that at
I get
home.
emo already, kind frustrated already. So we wait for this, okay? Until he's completed this, he's not allowed to roam like outside on the ground or grass.
Oh, so don't bring him out for walks.
No, you can carry him out. You can bring him out to see things, but
He must be in our hands.
yeah, not
He
on
cannot
the
be on
ground.
the floor at all.
Yeah, not on the ground. No sniffing random stranger dogs if you do not know whether they are
No,
up
he
to
doesn't.
date with their vaccines.
No, he doesn't.
If they're up to date with their vaccines, it's fine. We need him to get used to going out, seeing different things, smelling different things, getting used to the noise also. And what else? Okay, so no going out yet until he's fully vaccinated. No going for grooming yet until he's fully vaccinated. Bathing only when he's well. So he's had a shower already?
Yeah, last week. Today
Okay.
he's going to have another shower actually.
Okay. Depending on how is he, we don't usually say you gotta shower them strictly weekly. You shower as needed when they smell.
But actually we noticed that his body doesn't smell, but his mouth smells a lot.
Yeah, so it's a little bit like it's a new puppy smell. It's like from whatever food was fed prior. And usually they are confined in an area with a lot of puppies and a lot of dogs. So it's a very typical smell we see. Over time with regular baby it will go away. Maybe a combination of a bit of poop and pee that he try to eat out.
He doesn't eat his own poop, but he likes to sniff.
Okay. Because I'm just a little bit worried that we're going to run some blood for him
you
and
doing that.
he's too stressed with today's visit and you bathe him at home, maybe not too ideal.
Okay, so then we don't wait him today.
Maybe wait a couple of days.
Maybe we give him a like a
Oh,
wet
wipe is
tissue.
fine. Yeah, wipe is fine. Yeah. Okay. Can we try to collect some blood? Yeah, a bit tired already.
I think he's tired.
Yeah.
Sleepy. Normally he's sleeping at this time.
Okay.
Can I give him a snack before, in between his meal times, or is that bad?
What type of snacks?
Like, is it okay to give any other kind of vegetables also to him, or is it too early?
Broccoli is quite safe as a snack sometimes.
Cauliflower?
Cauliflower, okay, both broccoli and cauliflower actually can be very gassy.
Okay,
But-
so now I'd rather
so
not
not
give
now.
because
Yeah, not
because he's already gassy.
Yeah.
Mm.
Cooked pumpkin can help with diarrhea sometimes. You
Okay.
can give that.
Yeah, we have pumpkin at home. Did you cook it today? Okay.
So no, we do not want to encourage too many snacks at this age yet. You use snacks as a reward for training,
Yes.
but he can't take snacks now because he's not feeling well.
Yeah.
So maybe a few more weeks before we make it more consistent.
Okay. Mama boy. Okay.
Alright. So other things we gotta keep in
You're
mind.
okay. You're okay.
The parasites they get, that kind of worms, occasionally is not common, but sometimes it can spread to us.
Ah.
So we actually recommend no kissing around the mouth for now.
No, we don't kiss him in the mouth.
Yeah,
But he licks my face. Don't.
not for now.
Okay.
Very rare, but sometimes it can spread to us also.
Okay.
Yeah. Okay. Then keep cleaning.
But
the
if he licks our feet and hands, that's okay.
Don't touch your feet and then touch your face
Oh.
after that.
Okay.
Yeah.
Okay.
Alright, so you okay? Can I carry you? We try and get the
I think he's
little
sleeping. He
blood.
should be okay.
Okay, sleepy easier, right?
Yeah. If he's
Alright.
if he's hyper, how about touching his bottom is okay.
It's the same. It's because how the parasite spread to us is from the bum. So
Okay.
you touch here and touch your face, the risk is high.
Okay.
Okay, so we got to cut down that for now.
Okay.
Alright? Okay. You have a seat first outside. Actually, I get my nurse to help you with the blood flow. Huh?
Okay.
Thank you. Alright, good boy.
So don't let him lick us. If he licks immediately wash him.
So naughty, you can't sit on top. You can't be so naughty. Sit.